The most valuable thing for me was I was always a believer that moderation would take care of things. And despite having relatively healthy lifestyles, I was still prey to a pretty serious illness which could essentially have either crippled or killed me. My name is Venkatraman Balaraman. I'm 56 years old and I'm a practicing neonatologist in Honolulu. Neonatologist is an intensive care pediatrician, and my life was a very busy, pretty much long working days, about somewhere between 12 to 14 hours of work. In general, about 6 days a week, and I was a fairly active person, played tennis with my family members, enjoyed hiking, so maybe 1 or 2 weekends a month. So I believe that I was in as good a shape as I could be. So the first time I had any inkling of having a problem was when I was playing tennis with my son. We played for about 45 minutes and pretty much it was obvious that every time I ran around chasing balls down, I would get a fairly dull kind of burning pain in my chest, which was unusual. It had never occurred before. I was in a cardiac catheterization table within 24 hours. And essentially what it showed was extensive coronary artery disease. I had cardiac bypass surgery done, and I actually had bypasses in 5 different blood vessels. This diagnosis is always shocking. I have had chronic illness, which does put me at very high risk for having cardiovascular disease. I was just surprised at the extent of disease, given the fact that I did what I felt I was doing to prevent or at least minimize the progression of this disease. In my own mind, my rehab started the very next day because I felt I needed to commit myself to a better regimen, essentially walking in the hospital, and probably before I was discharged, I did more than 15 to 20 miles of walking within the corridors of the hospital, and that made me feel good. I was very anxious and impatient to do everything that I could do to get myself back to health, and so kept bugging my cardiologist's office to get me into a program. There were 2 things which the rehab program was attractive to me. One was really the recommendation from the cardiologist about the program, and certainly the second one was financially, that was very attractive, and so both of them together brought me to the doors of this facility to get it going. Certainly what kept me coming here was really the commitment of the staff who worked at the program, who were so encouraging and enthusiastic about supporting the patients who came through here, and I found that positive motivation to keep going with the program. My diagnosis to now, it's about 1.5 years. I've lost about 35 pounds, and what the cardiac rehab program has actually done for me is to create a sense of what needs to be done for me to maintain relatively good health. It has made me incorporate daily exercise as a part of my life, things like yoga, so that they all contribute to my positive frame of mind as I move forward with my life.